both in Homewood and our McNeill, Alabama locations. And I'm here today to talk to you guys a little bit about stress. Now, I know this is a topic that all of us are super familiar with, especially these days. But what you might not know is that physical therapists are uniquely equipped to help you manage your stress and its physical implications for your body. So before we get into all those things, let's back up a little bit and just make sure we all understand what exactly stress is. So stress is a natural response that your body takes when presented with a challenge or a danger of some kind. So it started way back when human beings had to face real and present dangers and decide if they were going to take a fight or a flight response. Now, I hope that none of us are being chased around by wild animals these days, but we are still experiencing stress, and that same response is 100% real, and it has physical effects on your body. So what happens when you're faced with a stressor is there's this cascade of chemicals and hormones released through your body, things like epinephrine and cortisol, and they kind of prime your system and get you ready to make that fight or flight decision. However, if you're chronically stressed and those chemicals are staying present in your body for too long, they can cause problems like inflammation, pain, and just general dysfunction of your whole system. So stress triggers are different for everybody, but some of the things that I think about when I think about stress are change in environment, change in occupation, maybe family illness or personal illness, tension in relationships between your family and friends, maybe a natural disaster, some kind of trauma, busyness. And if it's starting to sound like 2020 in a nutshell, you've kind of got it. So we here at Therapy South know 2020 has been a rough year for everybody, and chances are you're facing some real stress in your life. And we want to give you a couple tips and tricks today to handle that stress the best you can. So let's start with talking about pain. So I feel like in the last couple of months we've had an increase in diagnosis of neck pain, back pain, and headaches. And I think a lot of this is coming from the stress of the year. But I think another thing that might be happening is a lot of us are working from home, and all of a sudden our ergonomic setup, the way we're actually positioning our bodies to work, is less than ideal. So I want to give you a couple tips to help set up your home office a little better, to decrease the pain in your back, neck, and decrease some headaches. So let's start from the ground up. Whatever you're sitting on at home, I want you to make sure that both of your feet are on the floor. So resist the urge to pull your legs up underneath you or sit cross-legged for too long, and definitely stay off the couch and out of bed if you're trying to work. If you're vertically challenged like me and your feet don't touch the floor in most of the chairs that you sit in, try to find something to put up underneath them, like a shoebox or a stack of textbooks, just to make sure your feet are planted and your back and hips are well supported. Now for your screen. I feel like most of us are probably using some sort of technology these days for working, and then we often adopt the sort of forward head, rounded shoulders, super flexed position of our neck in order to see the computer screen. So boost that monitor up. If your monitor won't shift up and down on its own, again, find something to put underneath it so it's in direct line with your eyes. It's going to decrease a lot of neck pain and tension for you and decrease headaches. Lastly, I have Holly here, and she's one of our lovely techs here at Homewood, and she is going to help me show you a couple of stretches you can implement through your workday to decrease some of the tension in your neck and shoulders. Okay? So Holly, the first thing we're going to do, I want you to sit up nice and tall. She's going to take both her hands and hold on to the bottom of her chair, and we're going to stretch the upper trapezius muscle first. So this muscle comes from the base of the skull down and out towards the shoulder. So she's going to take her ear just like she's doing and tilt it down towards her shoulder. She's going to take big deep breaths, and she's going to feel a big stretch right here through this muscle. Okay? So when you do this stretch, take big deep breaths, count to 30 or so, and then switch, go the other way. Holly, can you show us going to the other side? Perfect. So now on the left side, big stretch down the upper trapezius muscle. Thank you. Okay, the next one we're going to show you is for the levator scapula muscle, which is a little bit more on the back side of the neck. Gets really tight and tender when we're looking at our screen down all day. So for this one, Holly's going to keep her hands right where she's got them. She's going to take her nose and she's going to tilt it down towards her armpit. And she's going to feel a big stretch down the back side of the neck. Same thing, 30 seconds or so, taking big deep breaths, and then switch and do the other side. Go ahead and show us on the right, Holly. Other side, big stretch down the back of the neck. Okay? Lastly, let's check in with these postural muscles on the back side of the shoulder blades. So they run in between your shoulder blade muscles here, and these are super important for keeping us upright, again, reducing that rounded shoulder posture. So all Holly's going to do is she's going to think about taking both of her shoulder blades and squeezing them together and down as if she's putting them in her back pockets. And then she's going to relax. And she's going to repeat that again, back and down, and relax. So if you take a few minutes in your workday to try these 2 stretches and this one exercise, I think it's really going to have a difference in the type of tension and pain you might be feeling in your neck and head throughout your day. All right, the next thing we're going to talk about is breathing. So when we are stressed, one of the first thing that falters is our breathing pattern. So instead of using our entire lung field to take nice, big, deep breaths, we tend to shift all of our breath up into our chest, which can increase the tension that we just talked about trying to reduce. So I want to teach you guys how to do diaphragmatic breathing, or belly breathing, which is using the diaphragm, that big flat muscle underneath your rib cage, to really expand the lungs and make sure you're getting enough oxygen to your tissues. So if we don't have enough oxygen coming in with each breath, you're going to find your heart rate's going to elevate, your blood pressure's going to elevate, and you're going to start holding tension in different areas of your body, such as your jaw, your neck, your pelvic floor, and maybe even your glutes. And you may not even be aware that this is happening. So Holly's going to help us learn how to take diaphragmatic breaths. So she's going to put her hands on her belly, and she's going to take a big deep breath in through her nose for a count of 2. 1, 2, and she's going to feel her belly get big, and then she's going to exhale through her mouth for a count of 4. 1, 2, 3, 4. And she's going to do that one more time. Big breath, feel your belly expand and get large, and then back out through your mouth. 1, 2, 3, 4. If you practice this, if you do 5 or 10 deep breaths like this in the middle of your day, I promise you're going to feel a difference in your body. You're going to feel the tension reduce, you're going to feel your heart rate come down, and that stressful moment is going to all of a sudden become a little less stressful for you. So you can practice this in a seated position like Holly was. You can practice it standing in line at the grocery store or laying in bed before you go to sleep at night to get rid of all of that extra tension. Last but not least, I just want to talk to you guys a little bit about exercise. So we as physical therapists are movement experts, and we teach people to exercise every day, all day long. But we do realize that when a lot of our community shut down earlier this year, a lot of us lost our exercise routine secondary to gym closing, equipment's being shorted, class sizes being smaller, and all of a sudden your nice normal exercise routine is disrupted. Now the reason that exercise is important for stress management is because when you exercise, you get this huge release of endorphins in your body. You've probably heard that word before if you've ever been to a gym class. But these endorphins are super important because they act as natural painkillers. They can actually decrease inflammation, improve our sleep, and just decrease our stress level overall. So if you feel like your exercise routine got a little disrupted, I just want to give you a couple of ideas to get you back on track. So the weather is finally beautiful. It's not so hot. I really encourage you to get outside, walk or jog in your neighborhood, maybe try biking or rollerblading with your kids, or maybe start a family game of frisbee or kickball in the backyard. If fall allergies have got you down, or you don't have a space at your home where you can be outside, take advantage of the internet. You can find literally any kind of exercise routine online these days through things like YouTube, Beachbody, all these different things that you can access from your own home that don't need a lot of equipment and can kind of meet you where you are as far as exercise intensity. So I hope some of these tips and tricks were helpful to you and make you feel encouraged and equipped to manage the stress in your life. If anything that I've said today or my colleagues have said in the weeks past kind of hits home with you and you feel like you could benefit from our services here, please go to therapysouth.com. We have 35 locations close to you, and give us a call. We want to make sure that you finish 2020 feeling as full and healthy as you possibly can. So thanks for spending some time with me, and we look forward to seeing you soon.